Medicare's annual enrollment period begins October 15th, but starting on October 1, you can start reviewing the plans that will be available to you. And here to talk with me about this is Jay O, author of Maximize Your Medicare. Jay, welcome.
Thanks for having me, Bob.
Jay, it's always a pleasure, and it's always a pleasure to learn something new that I didn't know the day before. So, so take it away.
So yes, October 15th is the beginning of the annual election period. That is the official name for it. Tomorrow or on October 1st, depending on when you're viewing, you can actually see all of the details to Medicare Advantage plans as well as your Part D plans. In fact, on October 2nd at 2 o'clock Eastern, I'm going to be having a closed session, a live webinar, where I'm actually going to be examining plans in front of people and taking questions. But during this period, October 15th, the annual election period, through December 7th, you can freely change your Part D plan as well as Medicare Advantage plan. You can change your mind as many times as you'd like. The last plan you select ending on December 7th will be the one in effect on January 1st.
So from your perspective, Jay, as people think about which plan is right for them, are there some considerations that they should be conscious of?
Yes, and I know that there's a lot of advertisements and noise and information mail. The main thing, for example, in Medicare Advantage, something that I point out very regularly in Maximize Your Medicare is you're going to want to make sure that your network is configured correctly. Meaning, the last thing that I want our clients to encounter, the thing that we fight very hard to avoid, is for you to visit a doctor and for them to say, we don't accept this card. Depending on your Medicare Advantage plan, you could be charged extra cost, meaning they could be an out-of-network provider and you've got the right plan, or you have a different type of plan and you are responsible for 100% of the cost. Those are outcomes that Maximize Your Medicare guides people to try to avoid. And of course, private clients would definitely go through that exercise on a one-by-one basis. Unfortunately, one size doesn't fit all.
And for beneficiaries that want to change from Medicare Advantage to original Medicare with Medigap, there's some things that they need to know as well.
It's an important time because October 1st is the time that I encourage people to think through this very, very carefully. And the reason is that I don't want persons to be without extra medical coverage beginning in 2022. So therefore, the steps need to be done in order. And step number 1 is to find out whether or not you can be accepted in the Medigap. So if, for example, you don't qualify under the Medigap open enrollment period or other guaranteed issue or other standards, I have a video on YouTube about it, those 3 groups, if that is not you, then you'll have to pass medical underwriting. That does not happen overnight. The carriers ask different questions. And so as a result, you're left in limbo. I would want to find out your status first before going ahead and choosing a Part D plan. And the reason for that, Bob, is that if you just choose a Part D plan, it will eject your incumbent Medicare Advantage plan automatically. And so that's the reason that you want to do these steps in that order.
Right. And we've talked about this in the past. If you're denied coverage, a Medigap policy from one carrier, and you apply to another, you may not necessarily get that plan approved by the second carrier.
It seems like a good idea. Okay, I'm a borderline case. My health is not great, and I'm not quite sure. And so the idea is everyday people may think that it's a good idea. Why don't I just apply to 5 different carriers simultaneously and see what happens? The issue is that the carriers do have the right, first of all, to ask you, and they will ask whether or not you've been denied in the past from another Medigap carrier. In addition to that, the information is held on a consolidated basis in order to prevent insurance fraud. So as a result, if you're denied from the first carrier, let's just say your odds of being accepted by the second carrier probably haven't improved. That's the practical reality.
Right. And then generally speaking, just to double back for a second, the advantage of switching from Medicare Advantage to original Medicare with Medigap is that though your cost may increase, your access to networks increases as well.
There are a number of different considerations. This is kind of the key question for persons on Medicare, which is, if I'm going to try to figure out what my Medicare configuration would be, is it Medicare Advantage or Medigap? And beyond the scope of today, the main things are the fact that Medigap has coverage that is standardized and can never change. The only one that can cancel is you. That said, you are paying a higher premium for it. Medicare Advantage, many plans at $0 a month. That's true. In addition to that, extra benefits. That said, you need to understand that the contract is annually set, meaning that all of the details, all of them, are subject to revision every year. That's not necessarily negative, Bob, and I don't want to leave it as a negative message, because the competition in the world for Medicare Advantage is so intense that the tweaking, the details have been moving in the consumer's favor, if people know where to look and how to compare.
Right. So I guess the bottom line for folks is to really take this seriously. I know many folks probably just sign up for the same old plan that they had the year before, but it would behoove them to really do some due diligence on this.
It's human nature. People don't like change. It's not only the Medicare crowd, of course. That said, in this particular instance, in this particular situation, it can only help you either by better benefits or reducing your costs, or hopefully both.
Jay, anything that we haven't touched upon that's worth mentioning before we wrap up?
Well, we've got about 100 hours of material that we could talk about, Bob, but for today, I think that is a good stopping point.
All right, Jay, always a pleasure chatting with you about all things Medicare. The book is called Maximize Your Medicare, and they can find out more about the YouTube videos at maximizeyourmedicare.com. Is that right?
That is right, Bob. Thank you so much for having me again.